Blood in your semen? Here's what it could mean. Have you noticed blood in your semen? For many men, this is one of the most frightening things they will ever see. Some immediately think, do I have cancer? The good news is that in most cases, the cause is not something life-threatening. But there are situations where blood in the semen should never be ignored. As a practicing urologist, I'll explain the most common causes, when you should see a doctor, and when it's considered an emergency. What is blood in the semen? The medical term is hematospermia. It simply means that blood has mixed with the semen during ejaculation. The blood may appear bright red, brown, pink, or rust-colored. Many men notice it only once. Others experience it several times over weeks or months. One of the first questions many of my patients ask is whether blood in the semen means they have cancer. Fortunately, especially in younger men, that's usually not the case. Most episodes are caused by benign and treatable conditions. What causes blood in the semen? There are several possible causes. Cause 1, small ruptured blood vessels. The most common cause is simply a tiny blood vessel that breaks during ejaculation. This can happen after vigorous sexual activity, prolonged abstinence, or sometimes for no obvious reason. In many cases, it resolves completely on its own. Cause 2, infection or inflammation. Inflammation of the prostate, seminal vesicles, or urethra can cause blood in the semen. You may also notice burning when urinating, pelvic pain during ejaculation, fever, and more severe infections. In my practice, I often see men who have blood in the semen together with discomfort during ejaculation or urinary symptoms. In these cases, inflammation of the prostate is often the underlying cause. Cause 3, medical procedures. Blood in the semen is very common after procedures such as a prostate biopsy, prostate surgery, or some endoscopic examinations. This usually improves over several weeks. Cause 4, stones or cysts. Small stones or cysts in the prostate or seminal vesicles can occasionally cause bleeding. Although less common, they can lead to recurrent episodes. Cause 5, tumors. This is the cause most people worry about. Fortunately, it is one of the less common reasons. However, the risk increases with older age, recurrent bleeding, elevated PSA, abnormal prostate examination, or blood in the urine as well. Many men are extremely anxious when they see blood in the semen for the first time. In reality, if you're young, otherwise healthy, and it's a single episode without any other symptoms, serious disease is uncommon. When should you see a doctor? You should see a doctor if blood keeps coming back, you're over 40 years old, you also have blood in your urine, you have fever, severe pain difficulty urinating, or unexplained weight loss. These situations deserve further evaluation. What tests may be needed? Depending on your symptoms, your doctor may recommend urine tests, urine culture, STI testing, PSA blood test, ultrasound, MRI in selected cases, or cystoscopy if indicated. Most patients do not need every one of these tests. One thing I always tell my patients is not to panic after a single episode. But if it keeps happening, don't simply ignore it either. Persistent or recurrent blood in the semen deserves a proper evaluation by a urologist. Can it affect fertility? Usually not. A single episode of blood in the semen rarely affects fertility. The prognosis is excellent in the vast majority of patients. Conclusion: blood in the semen can be alarming. Fortunately, in most men, especially younger men, it's caused by benign conditions. However, if it keeps coming back or occurs together with other symptoms, you should be evaluated by a urologist. Early assessment can rule out serious conditions and provide peace of mind. If you found this video helpful, please like this video, subscribe to the channel, and turn on notifications for more evidence-based urology videos every week. Thanks for watching, and I'll see you in the next video.